First we're going to come over here to this apparatus right here. The on switch is on the back, and it should come up in just a second. As you can see, the table has the computer part, and it also has things like this kill switch right here. We don't call it a kill switch anymore, we call it a patient interrupt switch, but that was an old name from the old days. The patient's going to be handed that. This is going to be the rope that's hooked onto this harness, which will go around the patient's pelvic and lumbar region. I'm going to go ahead and set up the different traction pieces here, or the different setups for a lumbar traction. So first with lumbar traction, I'm going to hit lumbar traction. And I could do things like push traction technique and actually see a whole demonstration of how to set up everything. It's pretty easy. There's touch screen, and that could be done at any time. This whole thing will be available on your notes as a printed out thing, so we'll go out of that. Traction rationale, if you're looking for an explanation as to why we do traction. Again, you can read about this in your traction text. Now I'm going to hit edit, which is going to change the settings. Right now it's set for a progression of about 6 steps over 1 minute. It says 6 steps, 1 minute, and you can see goes up. Then there's a area where there's traction, and then it stops and it goes down to, if this showed the pounds over here, and let's say that mark was right there, that'd be 20 pounds or so. And then it goes back up to whatever the maximum was. And we haven't set any minimum or maximum yet. After this is called intermittent. It says right there, intermittent traction for 15 minutes. If I change this button right here, this is called a cycle, and see how it steps down, steps up, steps down, steps up, and it's going to go up and down, up and down. Or I could set it to this, and it's just constant traction at whatever pounds I set for that patient. We keep it on intermittent. And then this thing over here is called the regression, where the patient will slowly be taken off the traction to let their muscles accommodate to their body again. I'm going to set this, and the patient has already told me he weighs roughly 180 pounds. So we're going to put the maximum at, let's just say 43 sounds a good number, and enter. And the minimum, I'm going to set the minimum to 20, enter. And when I go back, you can see now the pounds have been added in here. Had I set it so there was no minimum, go back, it'll go all the way down to 0 in the intermittent phase. So I think the 20 pound was a good one, so we'll leave that there. And back, we can see that. So the other thing I like is sometimes to start a certain poundage before applying. You don't want to start from 0 because the person will get too bored. And so I'm going to change pretension to on. Pretension, I'm going to set it to the same as the minimum, which was 20. I'll keep pretension at 30 seconds. Over 30 seconds, we're going to pull 20 pounds of weight on the patient. You can see the pretension right there. So we've got a shorter progression and a long regression. Okay, so we're ready at this point. I'm going to keep rope speed at 30%. Sometimes if someone likes to have a sense of more pounds, we just increase the rope speed. And I'm going to use rope release later to undo the rope. So let's go ahead and set the patient up. So this is again the Triton table, the DTS table. I'm going to do a lumbar traction. The lumbar harness is pretty straightforward. I'm going to be putting it on a patient. I'm going to demonstrate first on me. It looks like you're rock climbing, so it's a good day. Pull down and across. And then you want to have the tail go center on the body. And then you're going to loop the piece through and tighten it. And then ultimately we will attach this part up here into this ring onto this harness. Okay, so I'm going to set this up on the table and then get the patient on there. Go ahead and have my patient lie on his back. Now, here's the trick to end up in the right position. Come on over here, patient. I'm going to have you sit with your tush so the crack of your butt lines up. Oops, come back up. Keep on going a little bit higher up there. Perfect. Now you're going to turn sideways and lay on your back and try to center yourself on the table as much as you can. And you may need to, let's check, I'm going to check where the thoracic piece is. Oh, I think he ended up just perfect. Now, the goal is to have his back right about where the gap is in the table. We want this lumbar piece to go over his iliac crest. So this may need to go just up a little bit. I'm just going to bring it up just a smidge. There you go. We'll rearrange it if we have to. Now, to tighten this, you should be sure to ask your patient if they've emptied their bladder. So hopefully it's not uncomfortable because it will compress a little bit. And I pull down and across. Does that feel snug?
Yes.
It's like above your hips there. And then this next part, it's optional to place this part through the slot right there. You don't have to do that. And I don't want to jostle him too much, so got to be careful thinking about patients who have this done are going to be in perhaps a back spasm or have some disc involvement. And I'm going to go through this buckle, and my goal is to have this ring in the center. So I have to keep switching it around a little bit more. Now I'm going to come to this side here to pull it tighter. Put it through here. Okay. How's that feel? Snug? Okay. Once that piece is in place, I want his low back to be more relaxed. So what I'm going to do is bend up your knees, and I'm going to have you lift up just a smidge. Good. And a little bit of adjusting here. There we go. I want this bottom piece to be as in the center as possible. These two leg pieces are going to go right here. Now, are you comfortable?
Yes.
Now, there is a way to change the pelvic piece here so that there can be an increased and decreased angle. And it's going to depend on your patient's comfort and your treatment goal. So let's go ahead and put your hand right here for a sec. If you can see how this can go up and can go down. So I'm going to bring this up a little bit and see how it feels to you. Do you like it better up?
Sure.
Some people do, some people don't. Around 6 to 10 degrees seems to be the average with our well patients who are getting the traction done. The next part is to do the thoracic aspect. This part has to come underneath the armpit, so every patient will be a different length, but this one has to be high enough up. I could actually have him move a smidge down the table. Let's go ahead and have you just, I know you're well, so I can get you to do this, but there you go. See, you went right into the armpit. It stopped you right there. This next part, I need to, again, Velcro these, but I need to pull in a diagonal and then push across. This one, you need to breathe all the way out first. So breathe in, breathe out. And the idea is you want this to be very snug. Does that feel very snug?
Yeah.
Can you still breathe though? Just going to tie a little bit. Now, some patients like to have the arm piece here because it kind of cinches them in there, but some people don't like it. Some people feel they need it because it would stop them from tractioning too much. So do you notice any difference if you like that piece in there or not?
I don't mind.
Yeah, I'm going to take it out because I don't think you're one that has to have it. Okay, to the bottom part. This next part is where I've got to take this hook and attach it to the ring. Again, the ring has gone a little bit off center, so I'll put it back into center again. And hook it, just slide it under, and it goes right on. Comfy?
Yeah.
Good. Now, would you like to lean up a little bit to watch?
No, I'm fine.
You're good? Okay. If I wanted to lean up the piece, let me just show it so these guys can see it. I would have to first bring up the cervical piece, and then I'd have to bring up the arm piece. So this is the cervical piece. I just lift this up and bring it up a smidge, and then I can bring this arm piece up a smidge. Okay? Keep it there or put it back down. What do you think?
It's fine.
You're happy. Okay. So you can really change the different positions with that one. When you lower those pieces, you have to put the arm piece down first and then the head piece. The next part is I have to hook the rope. So come on over here, Lisa, and let's look at this together. This right here is our rope release. I'm going to push my finger on this, and I have to keep my finger on it, otherwise it locks. So I put my finger, oh, see how it pulled in? Got to be careful. You ready? Here we go. I push, and I pull it out. It's going to lock if I let go of it. So here we go. Pull. Make it too long. See how my hand is all the way over here? And now I'm going to hook it right on the ring. Okay? Now watch how I have my finger right here. Watch how I do my finger here while I'm going to over here push the rope release. So just watch my finger. I need to make sure not to snap it down too quickly, because then that would pull the muscles in the patient, and potentially that strap could hit the patient and it wouldn't feel good. So slowly lower the rope. Now it's kind of tense. We've already set up our protocol, and for the sake of this demo, I'm going to change treatment time to a simple 2-minute treatment. So we have a 1-minute progression with a 20-pound pre-tension, and a 2-minute treatment with an intermittent cycle. And then we're going to have a 1-minute regression to a total of 4 minutes. Okay, so here we go. Ready, patient?
I'm ready.
Okay, I'm going to hit the start button, but before I do, it is fair for me to hand to you this thing called a patient interrupt switch. And I like to fade it through this little hook there so it doesn't fall off the table, and put it right over the heart. So if he has anything, he just touches his heart. Okay, on the left side is probably better, huh? And you can stop it. So just reach your hand up with your right hand, you'll hit it. Okay? Next, we're going to hit start, confirm everything, 1-minute progression, 2-minute treatment, 1-minute regression, starting at his pounds of 43 max. We're going to start at 43. Now how I chose that is it should be 25% of the body weight, and so we had already pre-calculated that amount. Okay, let's see, let's go ahead and hit start. It says release the table to unlock it. And it really is already unlocked. Here's the button where the unlock button is. And that's going to make the ability of this whole table to move. Now, if at any point you don't like this, just hit that stop button. So, right now, it's already raced up to 20 pounds pre-tension. So in that 30 seconds, he has 20 pounds on him. Probably not feeling much yet. When a person is injured and more acute, we want to do more steps during progression and a longer time on each step. So with a beginning tolerance test, if you will, to decide if this is good for them, do maybe 6 steps and make sure it's at least 15-20 seconds per step to allow the patient's muscles to accommodate. And right now we're up to 24 pounds. You begin to feel it at all? Usually you just feel the table. Yeah, the table's moving. Okay. We're at 28, working our way up there. And you can see right here on the screen, you can follow the progression. I see the number of pounds. I see the steps going up. I see the hold time happening. And then we're getting up there. You're at 35 now. Feel good?
Yeah.
If any time you feel like the weight's too much, I can actually change it and lower it.
Okay.
And when we get to the traction, you may say, I want it higher, and then I can bring it a little bit higher. And currently we're at 40. And now we've made it to our goal of 43. Now it's going to start into treatment. Now, what's fun is, right there, right here, we can see that this is opened up. Now, one of the things I didn't do is raise the table. I could probably have raised the table just a little bit more. You'll feel a little bit more tension when I do this. Yeah? Is it okay? You want the body to be kind of equivalent in height with the rope. So the rope kind of has an axial traction. Right there I was doing more of a traction to cause a little bit of a flexion or posterior pelvic tilt. Are you comfortable?
Yes.
Great. Now, do you think that you could have a little bit more weight?
Sure.
What I'm going to do now is not increase the weight, but I'm going to increase the rope speed. Increase it to 100%. And see if you notice a difference in this pull in a minute. It's going to finish this one part of the intermittent phase. Did you notice it pulling faster or more there? Because we weren't in an oscillation, it's not likely we would have felt that. There's a faster release. That was a release, yeah.
Release, right.
And now it's at the down phase. It's down to 20 pounds. And it's going to be a faster, not that slow progression. It's going to go fast into this next one. And we're almost at the bottom, finished part of the down phase, that weight hold part. See how it pulled kind of faster than before. So increasing it to 100% is fun. The other thing you can do is you can always change the maximum during the treatment. Start with the 25% of the body weight as your maximum and bump it up to work with your patient. Never go more than 150 pounds on a lumbar spine. Of course, that's really dependent upon the size of the patient. Okay, so let's go ahead. I switched it back to 30. You have very few minutes remaining, probably about 30 seconds to go. And at the end of all of this, the whole table will slowly regress. The rope will release the tension. See how taut it is here? It'll release. That'll allow this table to roll back because it is on a spring. And I will want to do some important things at that point. Disconnecting everything, of course, and locking the table. And I will also want the patient to get up very slowly. So we'll just watch him finish this out here. We're down to 38 pounds. You're in the middle of an intermittent phase. How do you like it?
Good.
Now, the important things about this is if any of this had caused any increased discomfort, or if he was a patient who had some radicular symptoms, you had perhaps a disc involvement, you don't want to do this if it hurts them. There should be no peripheralization of the pain during this procedure. So check in with your patient, do your tolerance. This is an easy way to do a tolerance test where I've done a 1-minute progression, 2-minute treatment, and a 1-minute regression to find out if this works for them. Then you know you can proceed. Most treatments are 20 minutes, sometimes 10, sometimes longer, sometimes up to 30. It really depends on the patient, on your purpose of your treatment, and so on and so forth. All right, you are now in the second part of your intermittent phase, so it's increased quite a bit right there, I'm guessing, as I was talking. You're at 44 pounds again.
Okay.
So I would suggest for your patients, get them a good magazine, let them install a pretty picture up on the ceiling, give them something to do. Apparently a lot of patients fall asleep during traction. So could you see falling asleep?
Yeah, I think so.
It's just sort of, you're all comfy cozy. The most important thing also, what will happen if there is a power outage? It is stated in the manual. If there's a power outage, everything will slowly, it'll just release. It'll allow anything to be taken off. So this will release its tension, and of course nothing else is electronic on him, so he would be able to get out of the apparatus. All right, we're on regression right now, so you're at 30 pounds. Have you noticed it coming off?
Yeah.
I did slow down the rope speed, so you didn't notice as much of a difference. So it doesn't change so much so quickly. With acute or tolerance tests, you always do a static progression. You can try intermittent's recommended, an intermittent traction, and then a static regression. All right, now you're down only to 16 pounds, and the table is getting closer and closer together as we're going. And one of the things I didn't really mess around with, but I could have, and since he's on low pounds, I could do this just to demonstrate this. There is a way to lift up this piece of the pelvic piece so his legs are up higher or lower. Okay, so you can change these different angles for all sorts of reasons. And there we go. You have 8 pounds and about 10 seconds to go. If he had hit stop, it would have regressed rather instantly. It takes about a minute of regression. So it doesn't just go sprawling, it just lets you kind of regress slowly. So I'll take away this. Now you're down to 2 pounds. I'll just hook that right there. Traction's over. Do you want to save this to your patient treatment card? No, I don't today. Let's go ahead now and watch him get off of the table. So I need to, again, use this rope release. Make it loose, lock it loose, unhook it, bring it down, and it's probably better to put the rope away. Now I'm going to lock the table so you slip slide away. Ready to breathe again? Yeah. It's not too bad, is it? No. And if you don't have that thoracic piece tight enough, there's a chance that he's going to slip too much. Next part, take this part here and unhook it. There we go. And then I'm going to come to this side so I don't jostle you around too much. Loosen this up. As this gets more used, this strap will soften and be easier to slip through the rings. And I'm going to have you. This next part's kind of important to not just, again, let him free. Do anything too fast. Put that there. And just let the patient get used to it. Now I'm going to have you come off to this side of the table. But first, let's go ahead and get rid of these one at a time. One leg down, another leg down. And I'm going to have you get on your side. And just ever so carefully get on your side. We'll come to a seated position, swinging the legs off the table. Now, if he was very much in spasm, we'd be quite concerned. We'd have to do a lot slower with more doctor assistance. And one of the hints about getting a patient off is to actually make the table a little bit higher so his feet are dangling. And so he can slide to the edge of the table. And I'm going to actually bring it a little bit higher so you can easily push off. There we go. Seems funny, make it higher when they're getting off, but it actually works pretty well. So let's have you just come to the edge of the table and just sort of slide off diagonally. And then in this position is where the patient's muscles are re-engaging, so you're beginning to use your muscles. And then just keep your back straight and come up very carefully. Does that feel good?
Good, excellent.
All right, thank you.